Traditional Chinese medicine was first brought to Europe as a natural method of healing in the middle of the 17th century. In Switzerland, as in other European countries, it's gaining in popularity and recognition. Swissinfo visited the China Health Institute in Lucerne to find out more about the development of traditional Chinese medicine, also referred to as TCM, in Switzerland. This is the chief doctor, Xudong Yang, who was formerly a professor at the Chengdu University of Traditional Chinese Medicine. He has extensive clinical experience. He comes across as warm and sympathetic, which helps him gain the trust of his patients very quickly. Swiss medical care is second to none, so it's not an obvious thing for Swiss people to opt for Chinese medicine, which is so different and strange. For Professor Jiang, the key to TCM is its effectiveness. For more than 100 years, Chinese medicine has been more or less synonymous with acupuncture as far as non-Chinese are concerned. But Professor Jiang knows that many illnesses are in fact better treated by other methods, including herbs and moxibustion, which entails warming specific acupuncture points with dried mugwort.
I think the herbs work better than normal European medicine. That's what I think.
What do they taste like?
They taste horrible, really horrible. You have to stick with it. At first you don't want to continue. You take them for the first time and they're so disgusting, but you mustn't give up.
Sabina Kuhn is a violin teacher. After 3 months of treatment, she wants to understand TCM better.
I don't really know what TCM is. I can't really make comparisons to know whether a doctor is good or not. I feel that it's a very harmonious philosophy. I like the way he speaks. He's very charismatic. I've learned to feel where my limits are. If I start to feel ill, I can think, stop, that's enough for today. When I have a problem, I can hear the doctor saying, balance, let go, relax.
So what is TCM really all about? What lies at its heart? What makes a really good TCM doctor? Dr. Xudong Yang is happy to explain. He has steeped himself for years in the two key texts of TCM, the Tao Te Ching and the Yellow Emperor's Inner Canon, and has a profound knowledge of them both. He has his own special understanding of them. As a doctor with years of practical experience, he has also helped many patients.
The main factor influencing every living being is the universe. A doctor shouldn't claim merit he doesn't deserve. For example, if a doctor says to his patient, "I've cured your trouble," that's not right. A doctor can never cure the troubles of his patients, even if it's just something small. So what is the role of the doctor? The doctor tries to activate the patient's own self-healing powers by joining him in the search for the cause. The real doctor is the patient's own self-healing power.
TCM looks at the patient holistically. The same symptoms may be treated differently depending on the underlying causes detected by the doctor. The essence of TCM is not simply curing diseases, it's even more important to take care of spiritual regeneration and health.
A good doctor shows the patient the way to the well-being of body and soul. This way is the Tao. In China, it's also called Taoism. It's a source of knowledge and philosophy.
In 2009, the Swiss voted to allow the inclusion of TCM into the list of treatments covered by compulsory health insurance. That indicates that they trust traditional Chinese medicine. It also gave the practice a chance to expand in Switzerland. The China Health Institute offers treatment to people in the Lucerne area to help them tackle their health problems and also to improve their physical and mental well-being. At the same time, it gives Swiss people the chance to learn something about Chinese culture.